How can I predict my fertile window?
Welcome to this video where we will explain how to predict your fertile window. Understanding your fertile window is important if you're trying to conceive, or if you want to avoid pregnancy by tracking your natural cycle. Let's dive in.
What is the fertile window?
The fertile window is the time frame in a woman's menstrual cycle when the chances of conception are the highest. It usually lasts for about 6 days, including the day of ovulation and the 5 days leading up to it.
How can I determine the length of my menstrual cycle?
To predict your fertile window, you'll first need to know the length of your menstrual cycle. Your menstrual cycle starts on the first day of your period and ends the day before your next period starts. You can track this by marking the first day of your period on a calendar for a few months to get an idea of the average length of your cycle.
How do I identify ovulation?
Ovulation is when an egg is released from the ovary and is typically the most fertile day in your cycle. To determine when you ovulate, follow these steps. 1. Calculate the length of your cycle. As mentioned earlier, track your cycle for a few months. 2. Subtract 14 from the average cycle length. This will give you an approximate ovulation day. For example, if your average cycle length is 28 days, you'll likely ovulate around day 14. Keep in mind that this is only an estimate and that ovulation can vary from cycle to cycle.
How do I predict my fertile window?
Now that you have an idea of when you ovulate, you can predict your fertile window. Since sperm can survive in the female reproductive tract for up to 5 days, and the egg can be fertilized for up to 24 hours after ovulation, your fertile window starts 5 days before ovulation and ends 1 day after ovulation. Using the example of a 28-day cycle with ovulation on day 14, your fertile window would be from day 9 to day 15.
Are there other methods to track my fertile window?
Yes, there are other methods you can use to track your fertile window. 1. Basal body temperature, BBT. Your BBT is your body's temperature at rest. It slightly rises after ovulation. By tracking your BBT daily, you can identify when you've ovulated. 2. Cervical mucus. The consistency and amount of cervical mucus change throughout your cycle. When it becomes clear, slippery, and stretchy, you're likely in your fertile window. 3. Ovulation predictor kits, OPKs. These kits measure the levels of luteinizing hormone, LH, in your urine, which surge about 24 to 48 hours before ovulation. Predicting your fertile window can be an important aspect of family planning. By understanding your menstrual cycle and using various methods to track your fertile window, you can increase your chances of conceiving or avoid pregnancy naturally. Remember, these methods are not foolproof, and factors such as stress, illness, or medication can affect your cycle.